Hello friends, today we will discuss musculoskeletal system examination. Overview. Preparation time given is 3 minutes. Try to utilize the whole 3 minutes for reading the scenario again and again and prepare your strategy before you enter the examination room. Time given for examination and discussion is 8 minutes. Warning bell will be given at 6 minutes. Total marks allotted 8. Introduction. Always great. Introduce yourself and define your roles and responsibility. Wash your hand with sanitizer and take all the COVID precautions. Ask for consent for examination and exposure. Make rapport by asking short question, what is your name? What is your favorite sports? And explain what you are going to do before examination. Look for dysmorphism, distress, any disease stigmata, and measure the height, weight, head circumference, and surroundings. Any device is there or not, any drugs there or not. Then do Pigal's examination, which starts from inspection, from front, from back, and from side. Look for any bony deformity, any bulging, any scar, any wasting of muscle, any rash which could be present in psoriasis. Any limb length discrepancy, how the spine look like, look at the foot, try to assess whether the patient is having any flat foot or not. Ask 3 questions before you do Pigal's examination. Do you have any pain or stiffness in your muscle, joints or back? Next question, do you have any difficulty getting yourself dressed without any help? And third one, do you have any problem going up and down the stairs? Then examine the gait, which is extremely important. Read the normal walk cycle, which stands for heel strike, then foot flat, mid stance, heel off, toe off, and swing. Then ask the patient to do tiptoe walking and tandem walking. Then assess the movement. Look for any swelling, any restriction of movement, any redness, and any loss of function of joint. Examine the upper limb, examine lower limb joint, temporomandibular joint, and cervical joints. Then examination of spine. Look for the shape. Is there any kyphosis, scoliosis, hyperlordosis? And do the spinal movement. Look for any any abnormality noted and do the examination. If any abnormality noted, one joint proximal and one joint distal to the joint involved. Read all joints function and movement from book. Look for hypermobility and check the Brighton score. If the Brighton score 4 or more, consider the patient is hypermobile. How it score? First, passive dorsiflexion and hyperextension of fifth metacarpophalangeal joints beyond 90 degree give 1 point each side. Passive apposition of thumb to flexure aspect of the forearm give 1 point in each side. Passive hyperextension of elbow beyond 10 degree give 1 point each side. Passive hyperextension of the knee beyond 10 degree give 1 point each side. Active forward flexion of trunk with the knees fully extended so that the palm of hands raised flat on the floor give 1 point. Total 9 point. And always check Gowers sign. It is important for muscular dystrophy, which is a sign of proximal muscle weakness. In order to finish examination, always check skin for any rash which could be present in arthritis as well as in psoriasis. Check the vitals. Always check temperature for any fever which could be present in psoriasis, systemic onset juvenile idiopathic arthritis. Hepatomegaly and lymphadenopathy could also be present there. And always check shoe. In order to finish my exam, I will do other joint examinations. Key points: always ask for any pain before you proceed. Try to assess what type of disability the child is having and try to assess where is the lesion. Management is always multidisciplinary. Common cases given: muscular dystrophy like Duchenne muscular dystrophy, Becker muscular dystrophy, Charcot-Marie-Tooth disease, which is congenital peroneal nerve palsy, and it is autosomal dominant. Arthritis, hemophilia, osteogenesis imperfecta, osteomalacia, juvenile idiopathic arthritis, hypermobility syndrome like Ehlers-Danlos syndrome. And always remember the classification of arthritis: monoarthritis where one joint involved, oligoarthritis where maximum four joints involved, and polyarthritis where five or more joints are involved. And polyarthritis is also classified in two parts, where rheumatic factor is positive. There, eye involvement is commonly associated, and another variety is rheumatic factor negative polyarthritis. And remember, juvenile idiopathic arthritis, the duration must be 6 weeks or more. Thank you.